chronic sitting, being in this position, seated all day long, driving at a desk, this puts a tremendous burden upon the psoas muscles. The iliopsoas are hip flexors. This can cause chronic back problems. It can cause pelvic tilting. It can cause contracture in an area to send referred pain to a different area because these muscles play such a major role with all other muscles surrounding them. So I want to show you a great stretch. It's called the gravitational release stretch of the psoas muscle. And it's so simple because all you have to do is find a little wedge, something you're going to stand up on, and you're just going to allow that one leg to dangle. When that leg dangles, you're going to feel nice release from that hip joint in that area where the psoas is attaching into. And this should really make a big change when it comes down to increasing range of motion and hopefully taking away a lot of your lower back problems. So I'm going to use a solid box. This box right here is stuffed with paper, but it's solid. And all we're going to do is that we're going to get close to a wall so you don't lose your balance. So what we're going to do, I'll face this side and I'll do my left side so I can look at you in the camera. And what we're going to do is we're going to take our right foot, step up on that little type of support or a bunch of books or something thick you can step up on. And as you step up here, you're going to let the left leg dangle. And when you let that left leg dangle, what we're doing here is we want to go ahead and tighten the core up, and you want to keep the buttocks nice and tight on the right side. That's stabilizing you up on the block. And take that left leg and just let it hang and dangle, just like this. And as it dangles, what you're doing is it's stretching the psoas muscles. It's actually working from the hip joint because that's where it's attaching. I don't want you contracting the muscles in the thigh or the leg at all. Just let it hang from that hip joint and let gravity do its work. You can go ahead and let that dangle about 30 seconds or so. And if you feel real tight in there, you can actually go longer and you'll do both sides. So the side you're going to do is the side that's closest to the wall. That was my left side. If I do the right side, we'll go ahead and put the left side up on here, keep the buttocks tight, keep the core tight, and take my other leg, the right leg, and just let it dangle from the hip joint as the whole leg is completely relaxed. And as you do that, just gravity pulling down that area will really allow those muscles to release and hopefully give you a lot of relief. So do this exercise often. It may be just a bunch of books, a block that you have laying around, or something that is elevated off the ground. Let that leg just start to dangle, stretching those psoas muscles, releasing that hip joint. You'll feel a lot more increased range of motion, decreased pain. It will help accelerate healing, take away a lot of the suffering you've been dealing with for a long time. And it is so simple. Only takes maybe a minute to do both sides. I really hope that this makes a big difference in your health. I ask you to share this video, and most important, make it a great day. I'm Dr. Alan Mandell.